Boston, the capital of Massachusetts, has faced high levels of drug use, much like other large metropolitan areas in the country. However, Massachusetts has been stricken in the past decade by unusually high levels of heroin and prescription opioid abuse. The number of people fatally overdosing from these drugs has dramatically increased since 1990. This is the story of a multi-pronged, coalition-based approach to slowing the sorrow and suffering that opioid overdoses have brought to our communities.
The story I've heard recently, and I was in Charlestown sitting with a grandmother in her house, and she has Section 8. And she was telling me her kids are struggling with addiction. And it upsets me to hear that story.
And I think this is really unique for an elected official, because what he basically has said is everyone needs a second chance, and if you don't have overdose prevention on the table, you don't get a second chance because you die.
There were pilot programs that were distributing Narcan in a few different communities.
I think if we focus on the active users, the family members, and the bystanders as well, then everyone will have a hand in it and know exactly what to do.
Back in the day when people were taking, they would overdose. When I say back in the day, I'm going back past 10 years. People would overdose, and if they would dial 911, the police would come, they would run.
There are still overdoses going, but when you look at from when we started this process back in '04, clearly there's been a huge improvement.
Well, that was back then, and I can honestly say now that our relationship with Boston Police is much, much better.
They're here because they care. They're here because they want to see us alive. And I'll tell you, a few more events of this happen, and once the street starts hearing about this, it's changing social norms.
And 9 times out of 10, everyone that we talk to, they say, yes, I'm more comfortable now, and I'm more likely to call for the first responder.
It is a good feeling to say something like that, you know? They started calling me doctor. It made me feel pretty good.
It reduces stigma. Education reduces stigma. And when you reduce stigma, it makes it safe for people that need help to muster up the courage to ask for the help.
So what are the signs of overdose? A lot of them are involved with respiration.
This is Narcan. The box doesn't actually say Narcan. It is labeled by its generic name, naloxone hydrochloride. Narcan and naloxone are the same thing. Remember that the informational materials in the kit can guide you through the process. While you are waiting for the Narcan to reverse the overdose, do some rescue breathing.
No matter what, somebody dying you care about or don't know in front of you is scary, and it is anxious. But having a plan in place hopefully is going to cut some of that negative stuff out.
Back in 1996, the state's Department of Public Health estimated that approximately 1,900 adult Latina women in the Boston area were in need of substance abuse treatment. Yet, back then, there was not one residential program with linguistically and culturally appropriate services for Latina. Entre Familia opened its doors in May of 1996 at the Mattapan campus, our newfound home.
The adaptations were required because we're working with women in early recovery. And being in early recovery, they are feeling mentally and physically quite agitated.
The very first challenge that I believe that we came across is that women found that mindfulness was just different from any other traditional substance abuse treatment. They just didn't see the relevance in it. They didn't think that it really had anything to do with substance abuse. It was like, what is this all about?
And you will get another tool for recovery. It teaches to be in the present. It teaches you to respond and not to react.
Mindfulness will help you all through your struggles and situations. And you don't have to use no more.